Yeah, I would probably need to understand a little bit more what you're talking about. I will just tell you this, though. The many facilities around the country, less so in California, but many facilities around the country that have not been able to make it and have gone bankrupt over the last number of years, the cause of that has been the REITs. The REITs and the ownership of the land. That has been a major problem in many parts of the United States, because as the REITs have increased the lease cost, that is something that the facilities have not been able to manage, given that. So I would just say I'd be cautious about anything that we look at here, given the experience we've seen in other states.
So you've seen that in other states, but has that been the issue in California?
That has been an issue in California as well. I'm just saying I don't think it has been as dramatic in terms of forcing facilities into foreclosure and into bankruptcy as much, but it is definitely an issue here, because we've seen that the REITs have run up the cost, to the extent that they don't. Now, there's different models. There's different models out there. Some facilities, I'm just thinking of one local facility here that's been a family-operated facility for 3 generations. That facility owner owns the facility and also operates the building too. In many cases, someone else owns the facility, owns the land, owns the dirt, if you will, and the facility, and the operator then operates the facility, and then a major part of what they have to pay then is they have to pay the cost of the lease, and usually to a REIT.
I'm actually really, really pleased that Mr. Cornett brought up the REITs. I couldn't agree more that the real estate pressure on nursing homes has been a long-standing issue. And if you actually look at some of the large, even publicly traded nursing home companies, the REITs sit on the boards of those companies. If you then look at owners of nursing homes as well as owning nursing homes and operations, when you have the same people owning the land, owning the real estate, and owning the property, as Mr. Cornett is very skillful, very correctly pointed out, they can apply pressure to the operations that can impact their ability to succeed and often end up leading them into bankruptcy if that pressure is too great. I mean, there are a myriad number of examples of this over the last 20, 30 years. So I actually think Ms. Cornett has really helped explain the fact that there are untoward pressures from real estate on the operations of nursing homes that are meant to be places where we provide care for very vulnerable people. And we really need to look for a way of either separating out this pressure, making changes to it, and I think there's a number of ideas that could be out there.